Dr. Giggie, thanks for joining us today. I'm in my 60s. I tell you that to tell you that back in the 60s, when I was in elementary school, no one knew what ADHD was. And had they known, I would be on a poster in every school in the country today. That was a difficult time because they just thought I didn't want to be there, and they just thought I didn't pay attention and wasn't a very good student. Turned out I was a pretty good student eventually. Now that you know what ADHD is, you're able to diagnose it. It's an entirely different world for young people and adults who deal with it. We're in a better place now, aren't we?
Definitely.
What was the breakthrough? When did doctors first start going, wait a minute, this isn't a bad kid. This is a disease that we can help with, we can diagnose, and we can treat. What was that point? What do you think was the genesis of us being able to help people?
Well, there were a couple of things that happened. One was the discovery that certain types of medications actually helped with behavioral problems with children who were hyperactive and had problems focusing. And that discovery really was made in the 1930s, but didn't start getting used until the 70s, really late 60s, early 70s, and then really into the 80s when it became pretty much common. It was psychiatrists, child psychiatrists and neurologists realized that these medications helped control those types of behaviors. The other breakthrough was the knowledge of how the brain operates, and that ADHD is actually a neurodevelopmental disorder that affects the way people process attention, process their impulses, and help focus and organize their world. So we realized when we learned more about neuroanatomy, and that was in about the 1970s and 80s, and that's really when the diagnosis became more formalized, and as we know now, it's called ADHD. So it was in that period of time. We
tend, I think, generally to think that it's a young person challenge, but people of all ages, adults too, deal with ADHD, correct?
That's correct. It is a neurodevelopmental disorder, and it occurs throughout the lifespan, starting in childhood. What gets termed adult ADHD or adult ADD is either an adult who was diagnosed with ADHD and then the symptoms continue into adulthood, and that's about 60% of people who are diagnosed as children or adolescents to continue with symptoms into adulthood. But then there are several adults who get diagnosed in adulthood. It doesn't mean it started in adulthood, it just means it never got caught when they were in children, because it's developmental. If
you have a diagnosis of an 8-year-old that you have a high level of confidence that they have ADHD, what are their expectations? Will they get over it? Do you outgrow it? Will you take less medicine as you get older? What are the answers to those questions?
Well, the brain matures, and as children age, some will outgrow it. The most common symptom that children outgrow is the hyperactive component of it. Let me just say, not everyone has both the hyperactive and the inattentive component. ADHD is a neurodevelopmental disorder that affects inattention, impulsivity, organizational skills, and for some people, hyperactivity. So people are diagnosed with either ADHD, sort of predominantly inattentive, or ADHD, which is often called ADD. And then there's also ADHD, predominantly hyperactive, impulsive, or people could have the combined presentation. So most people that continue on into adulthood have predominantly the inattentive symptoms and sometimes the impulsive symptoms, because as the brain matures, the ability to control hyperactivity improves as the frontal lobe matures, which is the part of our brain that controls our impulses.
It's a challenge if you're trying to learn arithmetic and you're not able to pay attention long enough as the teacher explains how to work this problem. It's a problem if you're an adult and work and can't focus on completing the task ahead of you. But are there even more severe problems? If left untreated, left unattended, can ADD or ADHD even present more serious problems down the road?
Yes, and I should also say that approximately 50% of people who have ADHD have what's called a comorbid other psychiatric diagnosis, like anxiety or depression, or even a learning disability. So many people that have ADHD have other conditions that can be exacerbated if the ADHD is not controlled. However, yes, if ADHD gets undiagnosed and not controlled, it can lead to actually increased rates of depression. It can lead to increased rates of substance abuse, and that's been very well validated in multiple studies.
Tell me about the medications you're using in 2017. I know we're all doing the best we can with the medicines we have. Are you happy with, I guess, or lack of a better term, comfortable with the medicines that you have available when you make a diagnosis, that you can probably find the right strength, the right medicine to help each individual?
Yes, we have lots of options, and when I started this profession over 20 years ago, many of these medications weren't available in their current forms. There are different categories of medications. There are what we call the stimulants, which are actually controlled substances. Ritalin and Adderall are the most commonly known medications in that category, and they come in multiple forms. Long-acting, which lasts most of the day, versus short-acting, which lasts for part of the day. And that's where a lot of our advances have been made recently, because there are different formulations. Now we have liquid forms, we have melt tabs, we have different forms that, say, if a child can't swallow a pill, can actually utilize, which is wonderful. We have a patch that's available. So those are the stimulant categories of medications. And then we have non-stimulants, like there's one called Strattera, which is the trade name, and it's a non-stimulant, so it's not controlled, and it works as well. And then there are other types of medications as well. Some of the antidepressants can be used to treat ADHD. And then there's some old blood pressure lowering medicines like clonidine and guanfacine. Those are some of the medicines that are out there that we can use to treat ADHD, and they're all FDA approved for this condition.
Correct me if I'm wrong. Diagnosing and choosing a medication might be simpler than finding the correct level of medication. Is that the hardest part?
Well, it can be tricky,
yeah,
because some people respond to some medications and others don't. One of the really wonderful things that we have available, and you're saying what's different now versus, say, when I first started doing this, is there's new and evolving technology called genopharmacology, where you can actually just take a swab out of the inside of someone's cheek, send it to a lab, and a genetic test will send you back someone's psychopharmacology genetic profile, and you can see what medications someone is more likely genetically to respond to. So it helps make that process easier. It's no set guarantee that a specific medicine is going to work, but it helps increase your chances that you're going to pick a medicine that's more genetically compatible with that person.
That's exciting technology. How recent is that available to you?
I started doing it about a year ago.
What do you know? And have good success with it?
Some success, yes.
Yeah.
It's been very helpful.
That's fascinating.
And it's also helpful if someone's not responding well to a medicine and you're having trouble, and someone is having a side effect. So it's quite a useful tool, and that's new.
I'll end with this. It seems to me that with all the technology and gadgets we have to get information, it would be easy. But I think it's true that there are many people out there who suspect their loved one, possibly a child, possibly an adult, deal with some ADHD, attention deficit issues, and don't know where to turn. They may not have access to you. They may not know how to get to you. What do you advise they do, maybe beginning with a doctor that they can get to? How do you start down the path of getting help for this?
Well, I would talk to their child's teacher and see what kind of feedback they get from the school. And then I would go to their primary care physician, either their family physician or their pediatrician, and then have that person do an initial evaluation screen. And if that primary care physician thinks it's necessary, to make a referral to a child psychiatrist or a developmental pediatrician. Another option is for the primary care physician to refer them to a neuropsychologist who can do some initial psychological testing, which can discern whether or not someone has a learning disorder versus ADHD, and if there are other comorbid disorders as well. So could go to a neuropsychologist. Very
good. This is all valuable information, useful information. I found it interesting, and I'm so proud of myself. I listened the entire time. Isn't that a good first step for me, maybe?
That's good.
Thank you so much, Dr. Giggie, for
You're
your time
welcome.
today. I enjoyed it.
You're welcome.
Thank you.
Thank you.